We're also going to be announcing this week the deployment of antibody tests at our drive-through testing facilities. So the antibody tests whether your body has developed antibodies, which means that you have had the disease in the past. And because so many of the cases we're starting to learn, or we've actually probably figured this for many weeks, the vast majority of cases appear to be either asymptomatic or the symptoms seem to be so minor that you wouldn't even necessarily think to go get medical attention. You look at some of the antibody academic tests, research projects that have been done at Stanford, in Santa Clara County, Miami-Dade, University of Miami did one, LA County, New York City and state have done them. What they're finding is the number of documented cases is one thing. The number of people with the antibodies is far, far in excess of the number of people who've actually tested positive with a diagnostic test. So that's important to know. If you're a healthcare worker and you have the antibodies, then obviously you have immunity. We don't know how long that immunity is. Some people think 6 months, 2 years. I think eventually we'll find out. But certainly that's important. If you work in a long-term care facility and you have antibodies, that's important to know. And then also just people, I've had people say, you know, I had a really nasty illness in late February. I went in, tested for flu, was negative. I may have had this. Well, you come in, if you have the antibodies, then you'll know. Usually the antibodies take about 2 weeks to develop. It's not something that would happen overnight. So certainly if you were infected anytime February, March, early April, we would expect the antibodies to show. So we have already received 200,000 antibody tests for serological testing. We've done a survey of all the hospitals that may need some, so we're going to send them to any hospital that wants it. Clearly it's important for the doctors and the nurses, so we're going to do that. And then we're going to have lanes dedicated to antibody testing at our drive-through sites, and so people will be able to come by and get through that.